autologous nerve regenerate 1 millimeter a day, so it takes a long time to go approaching here. So we tested how it feels, some misdirection of the sensation. So neurovascular island flux transfers show some rotation. On replantation, some defects of the same feeling. And then on the nerve grafting, patient feels like this. And small one, patient feel. So abnormal pattern of perception in the brain by finger pulse stimulation obtained after nerve repair. This is what I have done. The another thing, very interesting, fibromyalgia patient is very painful hand stimulation, makes some suppression of blood flow enhancement is suppressed comparing the normal side. So that's what I have done for the sensation of the fingers. And then we go to move to the motor function. Here is a joint in the middle of the hands. MP, PIP, and DIP joint. And then 8 carpal bones here. So we make very delicate function, motor function of these joints. University of Toronto showed very interesting findings here. This is a dead specimen. He pulled extensor first, and then what happened? Extension of fingers, and then intrinsic muscle here. Pulling intrinsic muscle makes MP joint flexion. And then profundus muscle, profundus tendons, makes full flexion of all joints. By sublimis flexion at the PIP joint. It's very interesting. By putting all together, very powerful flexion of fingers. Now, precision pinch and precision grip we human beings obtained by evolution. Deep pinch, palm pinch, and cylindrical, spherical grip, these are very important functions for the human beings obtained by evolution. What is evolution? By using hand, it's to show opposition fingers like this, makes enhancement of the supply in the sensory motor cortex. Here. That means brain cells are activated by opposition of fingers. This is normal person. So I'm going to show you later on the functional MRI later. And then what is proof of human evolution? This is opponent's muscle. Opposition of fingers. This is the human beings obtained by evolution by standing up and using hand. So this muscle had a development, made a development of brain. So hand and the outer brain of man. And also we say extension brain is the hand. So by using both hands, aging snaps of the brain causes death of brain cells and makes the brain aging. So dexterous precision hand movements makes the blood flow in the cerebral motor area 30% up, somatosensory area 70%, and the entire brain 10% up. That makes the brain cell activation. and then increase the quality of life and prevention of dementia, aging. So we can prevent the aging of the brain and mind by using a hand, especially the opposition of fingers. So this is a blood to show the blood supply in the brain. This is in Chinese character, because I made a lecture in China, Beijing, last year. This is another function of photic stimulation in the eye, make crossing here, and then stimulation causes crossing here and the occipital area. Occipital is the posterior side of the brain. Now let's have stimulation, visual stimulation, photic stimulation. Stimulation here, crossing here. This is enhancement of the supply. That means activation of photic center cells. And then we will make some other stimulation. Now, motor stimulation by opposition of the hand makes sensory motor area of the brain, and also ipsilateral side of the brain makes some stimulation like this. Here, this increasing blood flow, that means the activation of brain cells, and also ipsilateral side, there is some increasing of blood supply. It's very interesting findings that we never know before. So by both opposition makes a very wide area of the brain. So that you understand how opposition function is very important for the brain function. Another interesting finding is that the imagination of the pinching and like this. So pinching, and then stop, but still feeling pinching. So only by imagination, blood surface coming up, comparing another side. This is the real motion of the hand, makes increasing. But even by imagination, there is some increasing of the blood flow. That makes the activation of the brain cells. So once again, let's say photic stimulation here, makes crossing here, and occipital cortex is a coronal section in the center. So this is the photic center, stimulation center here, as nerve cells are activated. So very localized stimulation, enhancement of blood flow were obtained by photic stimulation. Now let's see the hand opposition, ipsilateral and contralateral. This is the primary motor cortex and supplemental motor cortex. And the contralateral side, sensory motor area, and brain cells are activated even on the ipsilateral side. It's very interesting findings. By both opposition makes a very wide area of the enhancement in the brain. That means hand function is very important for that. Now let's say hand is important, but Professor Setne's field, oral maxillofacial field, also has an important role in the brain. That's why Professor Setne interested in this paper. Also, so we make on a lost thumb, we produce like this by using second toes and then like this. So we're producing a pinching and grasping by this kind of work. So that's what the reason why we make the production of the pinching of the hand, because it makes spring activation. Now it's archaic smile. From Koryuji Miroposatsu makes pinching. That even by imagination, practical is coming up. She makes some world peace praying like this. That's what I want to talk today for you. I'm very happy to receive in September last year, I obtained the outstanding paper, the best paper award in China. It's very difficult time when it's politically difficult time, but they made me a very prize. This is a prize of the bronze statue was sent from Beijing, the Ming Dynasty bronze statue. I was very happy to receive it on this paper. Now I'm going to show you another one. Many thanks to Professor Gansley and Langhill. Was celebrated to have the diploma of honorary membership. Thank you very much. And also very big effort here and here. Effort by Professor Takasaki and Professor Yamamoto. I owe you very much. And also Secretary Oda-san, Secretary made this picture to show you. It made me very happy. Thank you very much for kind attention.
Thank you very much for your informative and impressive lecture from us. And time is too short. We have to move next session. So therefore, any question is not allowed in this section. Finally, I would like to thank Professor Hirasawa for your great contribution to the ICS Japan section. Thank you very much.
Thank you very much.
Now, a letter of appreciation will be presented to Professor Hirasawa. Professor Yamamoto and Professor Hirasawa, please walk forward to